One thing to know about implants in the body, no matter where you place them, is that if you put any kind of foreign material, the body will have an immune response that will then create what's called a capsule, essentially a scar tissue protective barrier around that implant in order to keep it from essentially affecting the rest of the tissues and outside of where that implant is sitting. Common complication of having breast implants is something called capsular contracture. And that's where the capsule forms, but the body almost does too good of a job where it continues to deposit scar, continues to thicken that capsule, and as a result, that capsule will tighten, and squeeze the implant over time. A lot of times with a silicone implant rupture, some patients may not even realize that their implant is ruptured because that gel is still going to remain intact within the breast capsule. The saline implant, because it is just salt water in that implant, if that implant ruptures or pops, you're going to know right away. When it comes to the risk of rupture, which means breakage of the implant, is that it's going to happen very differently if you have a saline implant versus a silicone implant. Welcome back, everybody. I'm Dr. Sean, a Beverly Hills plastic surgeon, and for today's topic, I wanted to talk to you a little bit about breast implant rupture and what that means if you do have a breast implant rupture and how you can actually manage it. So starting off, there's something really important to understand about breast implants, and it's the difference between the two main types. The first one is a silicone implant and the other one is a saline implant. Now, the biggest difference is in the name, where ultimately what's filling the implant in the silicone implant is going to be silicone gel, and what's filling the implant in a saline implant is saline, also known as salt water. Well, when it comes to actually having those implants, the reason you may pick one over the other oftentimes is going to be a lot of times patient choice and surgeon choice. I typically like to use the silicone gel implants because they have a much more natural feel and look to them, whereas the saline implants definitely have a firmer feel to them. But the other thing that you have to understand, where I have a lot of patients come in and ask me, they're like, oh, I don't want the silicone implant because they may have heard some negative things about silicone. They say, I don't want silicone in my body. What you have to understand about a saline implant is that, yes, the inside is filled with saline, but just like the silicone gel implant, the outside of the implant is still silicone. So by opting for a saline implant, you're not going to be like getting away from using silicone because ultimately the shell is going to be the same. Now, the biggest thing to understand, especially when it comes to the risk of rupture, which means breakage of the implant, is that it's going to happen very differently if you have a saline implant versus a silicone implant. A lot of times with a silicone implant rupture, some patients may not even realize that their implant is ruptured because that gel is still going to remain intact within the breast capsule, which I'll explain in a minute what it is, but it's going to stay within that capsule, so it may still feel like a normal, naturally augmented breast, whereas the saline implant, because it is just salt water in that implant, if that implant ruptures or pops, you're going to know right away. Because what will happen is that saline will immediately leak out into the rest of the body and be absorbed, and your breast will quite literally immediately deflate and lose all the volume it may have gotten from the implant it once had. So this is where the capsule part becomes really important. One thing to know about implants in the body, no matter where you place them, is that if you put any kind of foreign material, the body will have an immune response that will then create what's called a capsule, essentially a scar tissue protective barrier around that implant in order to keep it from essentially affecting the rest of the tissues and outside of where that implant is sitting. Now, when it comes to the breast, one thing that can happen and is a very common complication of having breast implants is something called capsular contracture. And that's where the capsule forms, but the body almost does too good of a job where it continues to deposit scar, continues to thicken that capsule, and as a result, that capsule will tighten, and squeeze the implant over time. Not only can this lead to implant rupture because of the folds that happen on that capsule or on the implant itself, but it can also lead to things such as discomfort, pain, and also deformation of the implant. So it could actually make it look like there's a constriction band or lift the position of the implants. So that's why usually capsular contracture has to be treated with surgery by removing the implant, removing that overly scarred capsule, and then replacing it with an implant if you do want to maintain the same level of breast size as what you had with the original implant. Now, what's important with this capsule when it comes to rupture is that this capsule, when an implant ruptures, especially a silicone gel implant, the reason it doesn't lose its shape right away is because of this capsule, because that capsule, like I said, is designed to wall off that implant from the rest of the body. So even if that silicone gel implant does break and the silicone gel starts leaking out, typically what will happen is that capsule will usually protect the rest of the body from any of that silicone gel, even though it's more cohesive and loosely floating around. And essentially that capsule of scar that's formed around the implant will become what is known as the capsule around the implant, so the gel should actually remain in place. And that's why a lot of times people don't know that their silicone gel implants have ruptured unless they become symptomatic in ways such as pain and discomfort, other than if they go and get an MRI. And that is why when you do get a breast implant, the current protocol states that usually you should get an MRI around 5 years after when your implant was placed, and then every 2 to 3 years after that to monitor for rupture and things such as breast cancer and other breast pathologies. So at the end of the day, that's why it's really important that if you do have a silicone gel implant, you're mindful of getting the right testing done at the right periods. And if you do have any concern for rupture, it is not an emergency in the way that some physicians may tell you it is. Sure, it should be replaced. It should come out sooner rather than later, just to prevent that silicone from eventually leaching through the capsule. But I actually did have a patient recently who came to my office because she had noticed she had breast pain. So she went to the emergency room. They did an MRI. They did a bunch of imaging that then showed that the implant was ruptured. What did they tell her? They said, oh, your implant is ruptured. This is an emergency. You need to have surgery right away to remove this, or else it's going to have huge complications for you. So when she called my office to tell me this, I told her right off the bat, I said, I understand that this is a distressing thing. Nobody wants a ruptured implant, but I promise you it is not an emergency in the way that you may have been told, because it's not like leaving it for an extra week or two is going to suddenly end up with a catastrophic result. The truth is that that capsule that's formed around it is and should do a good job for quite a while of time of keeping that silicone within the capsule itself rather than letting it leach into the rest of the breast. Now, if you leave it for like a couple years, I can't guarantee that the capsule is going to do its work. But ultimately, I told the patient, I said, you know what, if we do the surgery next week or the week after, this is not a catastrophic thing for you and it won't affect your long-term recovery. So if you do have a ruptured implant, I just want you to take a deep breath and understand that it's not going to affect you catastrophically just because you leave it for another week or two. But at the end of the day, that's really the gist of it when it comes to breast implant rupture and capsular contracture. If you do have breast implants, if you are worried about any risk of rupture or have been told that your implant is ruptured, I'd love to see you to discuss what the possible options are for it. But if you have any questions about your implants or specific to these procedures, go ahead and comment them below. Also, make sure you like, share, and subscribe to this episode so that way you can keep coming back every week for more pearls of wisdom from me, Dr. Sean, a Beverly Hills plastic surgeon. And I will see you next week for the next topic. Take care.